When I was in high school, toward the latter part of high school, I really wanted to go to medical school and thought that's what I was going to do. And I got a job at the local regional hospital in Effingham, Illinois. And I worked for 2 years there before I went to college. And I went through a lot of certification programs and worked in a lot of like the emergency rooms and worked on the different surgical floors, medical floors, long-term care floors. And I got to know the doctors pretty well. And in that area, one thing kept bothering me about the medical doctors is that they were there, they had their office hours during the day, and then they were going back to the hospital at night, and probably the majority, I'd say 75% of them, spent at least 6 nights a week throughout the night at the hospital doing emergency type stuff or admissions of their really sick patients or some of their dying patients and stuff like that. And after observing that for a couple of years, my background, I'm one of 12 children and I have a really strong family background. And I decided one of the things that I wanted out of my life was family was a high priority. And when I looked at what was happening with the physicians in the local area where I was, and it was a smaller area, they really worked 24/7 and had no family life whatsoever. And that's when I decided that maybe was a problem with medicine. And I talked to some of the physicians that I respected a lot that were there 24/7. And in hindsight, there were several of them that said they wished they had ended up in dentistry. So I started checking out dentistry at their recommendation, and when I checked into that, I found it still offered a lot of the challenges and the rewards of medicine, but it did allow for a priority of a family life.